volume good or?
Yeah, it's fine. Yeah, absolutely. Okay, so I'm your city manager, Mike Sims. I'm here talking today with Dr. Brent Bashir. He's our public health officer for the city of Terrell. He's agreed to give us a few minutes to chat about COVID-19 and all the issues surrounding that. Welcome, Dr. Bashir.
Thanks, Mike. Glad to be here.
So by way of intro, Dr. Brent Bashir graduated from the University of Texas Health Science Center at San Antonio Long School of Medicine back in 2001. He's been in practice for 18 years. He completed his residency at the McLennan County Medical Education and Research Foundation. He currently practices at Bashir Family Medical in Kaufman, and he's affiliated with Texas Health Presbyterian Hospital in Kaufman. He serves as the public health officer not only for the city of Terrell, but also for Kaufman County. So we'll just start right off with that. Tell everybody watching a little bit about what is a public health officer.
Well, up until a few months ago, it was kind of a fairly simple position. It was, it's basically somebody whose primary goal is to kind of watch out for the public health, things that are things like infectious diseases, obviously, but also other items that can create a public nuisance or a public hazard that may be a medical type question. It's just I'm basically serve as a resource for the county. The implementation or the actual work comes from the county officers, the county staff. But if they just kind of need a medical opinion or medical advice on things, that's kind of what I'm here for.
Great. I'm going to pass on the thanks from Mayor Rick Cremona and the rest of the Terrell City Council. You've been a valuable asset to them since you've been serving with us over this short few weeks. Folks may remember that back in March, when we initiated our disaster declaration, we also decided to get under contract with Dr. Bashir to serve as our public health officer also, and he's been doing a great job so far. First question for the public is a simple one. Why is COVID-19 different than the seasonal flu?
There's a few differences that are pretty technical, and one of them is just that it's a different virus. It's a type of a different virus. I think the real question that you're asking though is why is the disease itself different than flu? And I will tell you, just to be straight up honest with you, it's a learning curve that we're all experiencing. We're finding out as we go along, and as we spend more time with the disease, we're recognizing factors that show that the disease that it creates is a little bit different, a little bit more intense than flu. So people that get infected with influenza typically respond a certain way. Certainly with the wide range of people that get infected with influenza, you can see a wide range of response. You can see a fairly mild case all the way to somebody that has to be hospitalized, and even, of course, deaths. You see that same range with the coronavirus, but just over the time that we've been able to observe it, time that we've been able to see it, it does appear that it's a little bit more advanced as far as how often the more sick, the more severe cases come in. And so just the rate at which we see those more extreme cases seems to be higher than influenza. And I keep saying seems to because we're still, as data comes in, we're going to find out more. And as at the end of the next month and the month after that and the year after that, we'll know a lot more. And so we're kind of finding this out as we go along. But like I said, as it right now stands, as it appears, it looks like it's just a more severe illness. And then probably the other factor that makes it different or worse than influenza is just how kind of under the table it is. It's a little bit sneaky, because it appears to be quite a bit more infectious than regular old influenza, as far as people that have the disease and don't know it for a little bit longer period of time. So they're able to spread it a lot more quickly, a lot more casually before they realize they're sick. And that's kind of another unfortunate factor that appears to be true of this COVID-19 virus.
That's probably a good intro for my next question, which is the statistics as they stand now. So I'm here on the afternoon of April 15th, and the latest Texas State Department of Health statistics tell me we've tested 151,000 people. We've got 15,000 cases. We've got 1,538 folks in hospitals in the state of Texas, and statewide 364 fatalities. So one of the things that is a major question that people like to chat about related to this thing is the difference between a confirmed case and an undiagnosed case. How are we understanding that? What's that difference all about? And how's that driving public policy right now?
Yeah, that's a really great question. There's a lot to that. Let me try to unpack it a little bit. A confirmed case is a laboratory confirmed case. So somebody with symptoms who met the criteria for whatever reason, a clinician or a practitioner of some kind decided to run a swab or a test, and the laboratory result from that came back positive. All of those cases are getting reported to the Department of State Health Services, and all of those are what we call the confirmed cases. The undiagnosed, or the kind of underlying cases that we don't know about, there's a lot of patients that have symptoms that do seem to be presumptive for COVID-19. And because of our inability to be able to test everyone, we just don't have enough tests. And our advice from the beginning, and certainly more prominent over the last several weeks, has been that if you are doing okay, if you're healthy enough to stay home, even though you may be having some of these symptoms, we do recommend you stay home, to recover at home as best as possible, but to stay in contact with your primary care doctor, your provider, that can help advise you if and when you might need to be taken to a hospital setting or somewhere else based on your personal symptoms. So that's what we've advised hundreds and hundreds, if not thousands, of patients to do. And so those patients remain untested. And so they really are not going to go count against the numbers, and they're not going to count against our specific knowledge about how widespread this disease is, because as all of you know, it's possible that they may just have a common cold. And it may be that they, especially several weeks ago, they might have just had influenza. We typically see influenza to die out usually in late March as far as the flu season is concerned. So we're kind of suspicious now that the more common reason for those symptoms is going to be a COVID rather than influenza, but certainly a month ago it could have been either one. And so a lot of those that are just presumed or just assumed but recovering at home, they're never going to count against our numbers. They're never going to be reported to the state. They're never going to be on our websites to say, hey, here's another case.
So I've mentioned to several folks a little joke from County Judge Hal Richards, and that is the observation that it's a difficult name of what these disaster declarations are. So the disaster declarations have sometimes been stay-at-home declarations. Sometimes they've been called stay home, stay safe declarations. I think Fort Worth called theirs the stay home y'all order to try to make it sound nice and friendly. But our county judge had the joke going that, you know, we might ought to have called these things isolate orders, because that tells you more about how to behave even when you go out in public. So if I kind of take that thought about isolation, what's the advice for folks? Not just, hey, I have to stay at home now. That's the simple part. When I'm out in public, how do I translate this news about how many people might have it publicly into my behavior in public?
I think if you're talking about everyone's basic behavior, the best advice that we can give you is to do what we call social distancing, and to try to minimize the number of trips outside your home that you make. And then the other big factor with that is to minimize the number of people that go with you on those trips. So preferably just one, if at all possible. I know that that's not always possible, as we're not going to probably be able to police that, nor I don't think we should, but it's something that we just want to encourage folks. The fewer patients and citizens that are just outside in the area, the better off we are. And then probably even bigger, the bigger message is that once you do become symptomatic, in other words, if you did have a cough, if you did have a fever, then from what we know about most viruses, and we suspect is the same with this virus, is that during that phase, you have a higher number of virus particles in your cough, in your sputum, in your breathing even. And so that's why we say if you're having those symptoms, then there should be absolutely no reason whatsoever for you to leave your home. If you're one of those folks that is alone and not able to help go get groceries, and you don't have that help, please reach out to those community services. Reach out to your churches, your city, your neighbors, your friends, call them on the phone and say, hey, here's what's going on. Just trying to go with everybody's advice here. I've had a little bit of a cough, a little fever, but I'm really running low on groceries. Is there any way that you could help me out there? So that's the type of advice that we give people is don't trust a test to determine whether or not you decide to stay home. Trust your symptoms. And if you don't have symptoms and you do need to leave the house for whatever reason, be extremely cautious, because the number of people that are around you that are probably infected and just not tested is very high. It just naturally has to be, because we're just not testing nearly as often as we would like to. And so there's a lot more people that have the infection than the ones that are positive.
So what are the top 1 or 2 things that you would wish that folks would do when they're just shopping at the grocery store and walking around picking up those critical supplies? What are the couple of things you wish people would do when they're shopping?
If you can wash your hands 1,000 times while you're there, then you'd be a lot better off. And I know that's unrealistic, but the more you can, the better. And then really avoid touching your nose and your mouth. And that again goes back to what I was saying about the viral like load is what we kind of call it. If you maybe actually accidentally brush against the virus with your hand, and it kind of stays there until you're able to wash your hands, once you wash your hands, it's gone. And so if you have avoided touching an area of your face or your mouth or your nose with your hand, then you probably won't get the transmission. That's why just casual contact with someone who is positive is not thought to be a heavy suspicion of it being transmitted to them. That's why home contacts are a little more likely, but just someone who happens to work in the same office building as you, it's pretty unlikely that they're going to have spread that to you unless they were literally very close to you and also had a high viral load, so maybe a fever or cough at that time. So that's kind of reassuring, but it's also just we need to be pretty vigilant and pretty careful about the number of times we wash our hands, the number of times that we touch our nose and our face, and just watch out for those things. And then the more recent recommendation that we've given folks about wearing masks, those cloth masks, we don't think they protect you from the coronavirus itself. They can penetrate those masks. And that's not why we're asking folks to wear them. We're saying, because we believe it's more likely that it's transmitted during that kind of early stage, what you're doing if you wear that mask is that you're actually reducing the amount of droplet spread that you're creating. So if you happen to end up and become positive later, then if you wore a mask while you were out, that limits the amount of virus that you accidentally, unknowingly, and certainly not on purpose, spread to other people. And so we're asking people to do that as a way to help each other out, not to specifically help yourself. It unfortunately doesn't seem to help prevent virus from penetrating if virus does happen to get around and near those masks, but that's what we're asking.
So how does all of this then say, okay, now I'm not out in public, now I'm back at my house, I've got maybe somebody in my house who is self-quarantining, they're staying home, they're isolating because they had some sort of symptoms. What's the advice to the caregiver who's in the house with somebody who is having a health problem?
If you're a caregiver and someone comes down with the virus, if you've already been caring for them, it's pretty likely that you've been exposed. We just have to be honest with that. We're not careful enough the rest of the time to prevent that, especially in a household situation. But once you do have somebody who you're trying to isolate, if you do have the option of having them to use a different bathroom than everyone else, and just again still pretty aggressive hand washing and trying to help them to remember to wear a mask if they're going to be around other people, that certainly all can be helpful. And we're all just kind of doing the best we can. There's not just a super high expectation of perfection here. This is more just let's reduce the viral load that's kind of getting spread around, and let's see if we can maybe help reduce the chance that we'll be the one that gets infected. So that's kind of what we're going for there. It's not a perfect situation. It's not great, but it's certainly something that we just kind of want to try to mitigate if we can.
What about the folks at greatest risks of having this turn very serious for them? We hear a lot of people are going to be mild. You just talked about those folks. What about my folks in the category of a pre-existing health condition of some sort? Who's most at risk, and what should those folks be doing?
Much like influenza risk, if you were to catch the common flu as a healthy 40-something-year-old, then it's usually a very different scenario than if you're an unhealthy 75-year-old. And so that's kind of what we're describing. It's just what we already know about viruses. So if you're in that category where you have a disease that affects the lungs or diabetes, or you're in that older category or immunocompromised is kind of what we say, we encourage you to talk to your physician, your primary doctor, and just ask them kind of, is there something specific that I need to be watching out for? Do I need to be looking for different symptoms or a different kind of symptom? Because there's not really a great specific answer that I can give broad-based for all of those different scenarios. And so each person that has questions about their own health or their own risk factors, encourage you to give your doc a call and just say, hey, what else do I need to do other than just the general guidelines that are out there? But the general guidelines definitely still apply. The question is just, is there something more that I specifically should do?
So today was the first day in our statistics that the state of Texas had over 40 fatalities recorded. And I know a lot of people are watching and they're listening for the we've lowered the peak, or we've pushed the peak out, or we've reached the peak. People are looking for something to tell them something in the statistics, and maybe finding out that there were over 40 fatalities today is kind of a depressing note. What are we to take from all of the statistics that are out there and issues related to peak caseload? What message do we have that might be encouraging amongst all this?
I think the best thing that we've got going for us is that we have had much more time to prepare, and we've been social distancing for a much longer period of time. And let's not kid ourselves that we've been perfect at social distancing, but let's at least take some comfort in the fact that we've got several very good, even world-renowned hospital systems that are close by to us. One of whom has been through kind of an infectious disease scare and is extremely well prepared for this type of issue, which is the THR system, back with the Ebola scare of 2014, I think. And so their level of preparedness, I think, is way higher and way better than any of the areas that have been hardest hit in the United States, specifically New York City. Obviously, the epicenter is there because of their numbers and their the stories that are coming out of there. But we've had weeks and weeks, and it's turning into even months before we really hit the peak or those types of numbers that they're seeing there. And not to say that it still won't happen here. I understand that it still could, that we could have those kind of high numbers. I just feel like we're going to be so much better prepared as far as extra hospital beds. We've had companies that are making supplies that are going to help our staff workers. More PPE is going to be available to those healthcare workers because we've got companies that are changing their entire structure at their factories to help us out. I mean, it's just incredible things that are happening over the last few weeks and months, and the months going forward as we kind of gear up. And so I think our just level of preparedness is an absolute reason to be somewhat positive about what may be coming down the road.
I'm glad you said all that. I'll note for folks watching that the city of Terrell is having that same experience right now. We had some success this week acquiring about 150 locally made, locally sourced face masks, not for our emergency responders. They're using the high quality stuff, but for our civilian employees, we've got a stock of 150 washable, reusable masks. We think that's an important part of it. I noticed in the statistics late yesterday that there were still 5,500 hospital beds available in the Dallas-Fort Worth Metroplex. Mm-hmm. I think that's a good thing. We've got protocols we were able to put in place here at the city of Terrell with even just something simple like all of our firemen now have a monitoring system where we take their temperature before they go to work every 12 hours while on shift. So we're trying to make sure that we're aware of the health of our folks. We're trying to spread that information out. I appreciate something you said earlier, and I'll kind of end on this little item for myself, and then I'm going to ask one more question to you, and that is we did announce yesterday our Terrell Helps, which is our humanitarian aid program. That's available for people who are in the situation of having a positive test, and we've got a special program for them that people can learn about on our website. That's a good humanitarian aid program. So we do have several things that even here in the city of Terrell, we've set up to make ourselves more prepared and able to handle all of this. So in closing for you, you get the last word. What's the most important message that you want to highlight for citizens of Terrell?
Just that we have a great team. And I'm not even talking about me personally. I mean, we as Americans, as Texans, we just have a great kind of work ethic. And I think that our ability to come together is going to be highlighted. Our ability to look out for each other continues to be highlighted. And eventually, once the numbers shake out and the data comes out and we're starting to learn a lot more about this, we're smarter by the week. So everybody in that team is getting smarter because the data is better and the numbers are just more explanatory. We're able to kind of see what's happening. So that fear and that confusion that I've felt, I'm sure you guys have felt, for me is mitigated. It's getting better because I just feel like, we're learning more and knowledge is power. This is just one of those times where this is really true. So I just want folks to kind of trust the resources that are vetted, that are folks like the CDC and our local governments who are able to kind of sift through all that data that you see, use that and trust that because as we work together, I think we're going to come out on the other side of this a lot stronger, a lot better nation. And so I'm looking forward to seeing how we rise up and respond.
That's excellent. Again, that was Dr. Brent Bashir. He is the public health officer both for Kaufman County and for the city of Terrell. Thank you for your time today.
Thanks, Mike. Appreciate you having me.
Yes, sir.